Hey guys, welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. So let's say you've been diagnosed with an aneurysm. Scenario that comes up sometimes is, let's say you had a CT scan for your lungs or to look at your belly, and radiologist says, oh, I know we're not looking for aneurysms, but I see one. And then your doctor says, you need to go see a vascular surgeon. Off of the heart, we have what's called the ascending aorta, and it comes up towards, basically from your mid-chest up towards your head, hence the name ascending aorta, and then it curves into the aortic arch. So the aorta kind of curves from front to back, usually from right to left in most people, and then we have the aortic arch, and then the aorta travels down the chest, deep inside, right along the spine. This is called the descending thoracic aorta. Then it passes through the diaphragm. The diaphragm is a big muscle that separates the chest from the abdomen. That's generally right about here. So as we pass through the abdomen, then it becomes the abdominal aorta. Sometimes vascular surgeons and cardiac surgeons work together when the anatomy gets really complex, but with an ascending aneurysm, it's done by a cardiac surgeon. Oftentimes, it means replacing that part of the aorta with a graft that's sewn into place. Sometimes that involves fixing the valve. Sometimes that involves fixing the blood vessels down to the heart called the coronary arteries. The arch sometimes requires a little bit of a combined approach between the two specialties, but we have newer stent technology that is rapidly and actively being developed and now on the market now that allows us to actually place a stent here within the arch, including branches on those stents to protect the blood vessels up to the brain, up to the arms. And then we can fix the descending thoracic aorta with stents. This is all minimally invasive, no incisions, punctures, and a lot of times one night in the hospital, home the next day. And then as we come through the diaphragm down into the abdomen, we have the abdominal aorta. Now, most aneurysms occur in the lower part of the abdominal aorta, what we call the infrarenal aorta. That means below the kidneys and the kidney arteries. 98% of abdominal aortic aneurysms are fixed with stents nowadays. Where we are in the treatment of aneurysms is a really exciting time. It continues to rapidly evolve and change all the time. If you have an aneurysm, the next question is, well, where is it? Because that's going to determine who's really the quarterback on your care team, whether that's cardiac or vascular or sometimes both. Thanks for tuning into Whiteboard Wednesday. Dr. Edwards at Sarasota Vascular.